Tara. How are you?
Hi, good.
Thank you so much for joining me today.
Yeah, you're welcome.
The things that I really want to talk about is how your business came to life. What was the point in starting the mobile veterinary ultrasound business? How you've grown it, what has worked, what hasn't worked, any bottlenecks you may be having. So take us back to how it all started and what made you take the leap into mobile specialty services.
So I worked in specialty practice for about 10 years and ended up developing chronic illnesses. I have really bad long COVID,
Oh,
and I
gosh,
was
I'm sorry.
working 12-hour days that were just unsustainable. So I needed to find something else that I could do that wasn't within the kind of traditional practice setting where I could be a little bit more flexible with my hours, not work as much, just have a lot less stress on my body. My business partner is a veterinary technician, and we actually met when I was a resident over 10 years ago. She had always wanted to do some sort of business. She's a human sonographer that's also trained in veterinary medicine. So
Mhm.
she had always kind of wanted to do some ultrasounds and get into that for veterinarians and really wanted to partner with me on starting some sort of mobile practice for ultrasounds. And it wasn't something that I had ever really intended on doing. This was not a goal to own my own practice ever. I was always intending on just staying with the traditional specialty clinics. But we started this practice in 2023. It provides mobile ultrasounds, abdominal ultrasounds, and internal medicine consultations for area veterinarians. Now we also do upper and lower gastrointestinal endoscopy as well.
Do you have a big van that has all of your equipment and you bring the animal into your van, or do you go into the clinic with your equipment?
Everything's portable. Our ultrasound fits in a regular Pelican case, so we can wheel that in with the stand. We use the clinic's resources and typically have a technician help hold for us. For endoscopy, same thing. We use their anesthesia. Everything fits into our cars. Very portable, very little overhead, which was our goal. It's nice also because a lot of technicians and the doctors like to watch the scans as we do them. So they're able to come in and watch the scans and learn as well and see in real time what I'm finding.
Oh, that's great. And then they can ask you questions and you can dive kind of deeper, look a little bit closer. That's really interesting.
If they have specific questions about lesions that I'm seeing or recommendations, it's a lot nicer to have the veterinarian there because we can have a conversation on, I can get a little more information about maybe what's going on with the pet that's not necessarily in the record. So there's always kind of clinical impressions
Mhm.
that I like to get, and then I can be more in depth than necessarily when I write my reports. I can have a little bit more explanation of pathology or what exactly I'm seeing when I'm doing the scan. So it's nice to have the veterinarian there. A lot of technicians are really interested in what we're seeing as well. They
Oh,
like to come in, they like to watch. We'll show them exactly what we're seeing and the organs and what we're finding. We enjoy having people come in and just watch. We actually work with an emergency clinic that has owners present with the pets. So for some clinics and some owners, will actually have the owners there as well.
Is that good or is that a hindrance sometimes?
It could be a little difficult if we find something really bad.
Right. Yeah.
So I have to have a little bit more of a game face. We'll do in-home ultrasounds as well. So we'll actually go into clients' houses. If a veterinarian has a relationship, it's a mobile veterinarian for general practice, and they want us to go in, we'll
Uh-huh.
go in with the veterinarian and do the scan in somebody's house. So we work sometimes directly with the client, but all of the information goes to the primary veterinarian. So this is the primary veterinarian that's still in charge of the case, that still works with the client. So I have to have a little bit more of a game face. I can't really say, oh, this looks really bad or this is really weird. I have to
Yeah.
be a little bit quieter with what I say and then really talk to the veterinarian kind of as more of an aside as opposed to when I'm directly doing it.
Right. So the clients don't hire you directly. You're hired by the veterinarian.
Correct. Yes. So we work directly with the veterinarians themselves, and these are veterinarians who want to have an ultrasound for their patients who feel that is indicated. So
Mhm.
that's what we really want. We want to have a veterinarian be in charge and say that the ultrasound's indicated, as opposed to clients taking it upon themselves to think they need an ultrasound and maybe they need something completely different. We want to make sure that it's the correct diagnostic. Same thing with endoscopy, that it's the correct diagnostic for the pet, that we're not jumping to something. So we always have somebody in charge of the case when we work with them.
Can the client request something like if you have a dog that's going to have puppies, can they request that they get an ultrasound and you can come in, or does it have to be something that the veterinarian requests?
So if clients call us, we'll have them talk to their veterinarian and say, hey, I want an ultrasound. Sometimes the veterinarian wants to do something completely different, but that's what we'll instruct the client. We'll just say, hey, we're happy to come in. This is what we do, but we need you to contact your veterinarian and have them contact us directly.
So, what made you believe there was room in veterinary medicine for this type of model? Is it because the equipment is too expensive for vet clinics to keep on hand? Tell me about that.
So I know that there's some specialists that do mobile for some different specialties at clinics. So there's mobile surgeons, there's a mobile cardiologist. I've known internists who have started a similar model in different places. And really, there's not appropriate ultrasound training, or at least in-depth ultrasound training for a lot of veterinarians. My training is a lot different than what a general practitioner would have, because I do ultrasounds all the time. I've done thousands of ultrasounds. For me, that's one of the main things that I've done. And that's what we offer, that expertise. When I was in specialty practice, I would get a lot of cases that would just need an ultrasound and they could follow up with their veterinarian, or they needed to go to surgery, but didn't necessarily need an internist to
Mhm.
manage their case. So this is also something that we can see patients that are stable, that maybe have some chronic diseases, that might need other diagnostics or even need to see a surgeon or internist, but they don't need to be hospitalized. They don't need to have something that's directly an emergent treatment. The internists in the area now can actually see the patients that need to have long-term care or are more critical, that need to be managed by an internist, as opposed to one that just gets scanned one off and needs to go to surgery. There's not a lot of internists in this area, even in LA, and there's just not enough specialists. People can't get in to see specialists for weeks. I had a waiting list when I was in specialty practice. It would take a couple of weeks for people to get in. This is a lot easier. We can go to the clinic, and sometimes there's follow-up that's not emergent. Sometimes there's something more critical.
What strategies helped you from the very beginning gain traction? Because I know that starting a specialty practice is different than building just your traditional kind of veterinary clinic. What did you do?
So we did a lot of in-person marketing in specialty practice. That's the way to gain other veterinarians like to meet you. So we went into clinics, met with the veterinarians, talked to them. We had all of our marketing materials, our brochures on our website all ready to go. My partner has lived in the LA area for a long time and has worked at a number of clinics. She has contacts throughout the area. Knowing veterinarians in the area can help for referrals. And I know one of the clinics I worked at, one of the vets is my classmate. So it's a
Yeah.
lot of word of mouth, people knowing your name, and then a lot of it also is veterinarians liking our service and then telling other veterinarians about it. So it's a lot more difficult, I think, to market because we're not marketing to clients directly. So we don't
Right.
have advertisements or big social media that's pushing towards clients. It's all towards the practitioners.
Right. And I'm sure it's probably a big issue is gaining trust of the veterinarian in the very beginning. You don't want to come in and have them see you as a threat to their practice, or you're going to be taking their clients or anything like that. So I'm sure you want to establish a lot of trust and communication in the very beginning so you have that good relationship. Is that right?
Yeah, that's really important for me to be able to go in and talk to the veterinarian and have them have confidence in what we're offering for the service and my quality of medicine. Even when I was in brick and mortar specialty practice, I didn't do things like vaccinations or skin. I made sure they went to their veterinarian for that. And that's really important that the veterinarians who are referring to us never feel that we're going to take their
Yeah,
client.
stay in your lane.
Exactly. I don't have the expertise. I've never wanted to do that. And now, because we're directly mobile and work with veterinarians, they know we're not really chatting with the client and that they're still the ones in charge with the case. They still have the relationship with the client.
What makes a great partnership between a specialist and a general practitioner?
I think the first thing that as a specialist, I always really counted on were records from the veterinarian that were sent to me beforehand. I knew what I was seeing, that I knew what my approach would be. I still go over all the records when I do ultrasounds. I still look at everything. So having the veterinarian be able to communicate either through records or in person what exactly is going on with the pet. And then for me, really being available also. So I know a lot of practitioners like the fact that they can email me with questions, they can call or text me with questions. So I'm really available to answer any additional questions about the case. Sometimes it'll be about a completely different case.
Mhm.
So it's the availability, I think, for specialists that they like. And sometimes the things that I've heard about other specialists is that there can be some judgmental attitudes going on as far as, oh, you did this, but you didn't do this correctly. And to know that their job is to see a certain type of medicine, a certain type of cases, and my job is to do in-depth cases on certain things. And so we have totally different training, and there's nothing that needs to be judgmental about that.
Right,
Yeah.
right. I can see how that would happen though. How do you avoid stepping on toes? Say you have a general practitioner who has told the client, this is most likely what's going on, but we're going to get an ultrasound to confirm. And then you come in and do your ultrasound and you're like, by the way, you were totally wrong. How do you help them save face with their client?
It's always just coming from a place of learning. Here's
Mhm.
what I found. Here's the lesion that we're seeing. Here's what I would do. Here's the recommendations. Sometimes they listen, sometimes they don't. And that's obviously up to them. I give my suggestions. I will talk about what the current literature is talking about. And here's what we would do as internists as far as treatment and stuff like that. But it's about just really how you approach it.
Over communicating.
Yeah,
Yeah.
exactly. Yeah.
Speaking of over communicating, what is your communication process like when you take on a referral? Do you keep specific records or does the referring veterinarian keep everything?
So we don't have an electronic medical record system. We have just basically all of our reports, and everybody has their own file on our server. The records are always from the veterinarian. We have our own generated reports and report template that I send off, and those are all saved, and all my images are directly saved, but we don't use an electronic records system. We don't need all the extra features with it. We don't need a lot of those other things that a EMR would have. So it's pretty basic stuff, just kind
Mhm.
of templates, but it's all organized in a way that I could have everybody easily found. The gardeners are outside. They always pick the time that I'm doing a call to come,
Of
and
course they do. Of course they do.
always the worst time. Yeah.
So, do you have any systems built in that enable you to streamline what you're doing with the clients as far as the veterinarian sending you information in advance?
So it's nice if I get the case review in advance because I can prep all my records in advance. I really like to have everything prepared the day before, just so I already have the client information, the patient information, and really what the underlying things are that we're looking for.
Right.
That's not what always happens, however. So we actually go ahead and sometimes we'll just get records that we get on the spot. Today it happened where we didn't have any records. So we have to go and I have to go through the record and put it into the system. But because everything is really done in a way that it's very streamlined, so we have a Word document with our template, we have our ultrasound system with the patient name, I can go through things very, very quickly.
What is working really well for you right now? What are you most proud of as far as your business goes?
I think our quality of medicine is really high, and that is always a goal with me. I always want to practice the highest quality of medicine for my skills. I'm always learning, always finding new things, new lesions. I have a lot of experience with ultrasound and feel that my skill set is really high quality and I'm constantly learning with that. So that's something that I'm really proud of. That's always been my goal when I've been a specialist, to be as thorough as possible, as in depth as possible, and able to communicate my thoughts in a way that's easily accessible, not too wordy, not overly judgmental, but communicates everything.
You
Occasionally, I will with the wording. I'm very picky about wording and making things sound good, but I normally write the lesions out myself. If I'm writing full paragraphs for consults, I will use AI to help reword things just so I don't have to sit with my thesaurus. As far as everything else, I write it all on my own. I just not huge on AI, so I do more writing. I've written textbooks, chapters, so I don't really use AI for that. But sometimes if I'm writing a bunch of reports, it's actually much
yeah,
easier.
much faster. Yeah.
Yeah,
Yeah.
exactly.
What growth opportunities are you exploring right now? Or are you happy with where you are?
So we're looking to get new clinics and expand our reach. Like I said, we just started doing endoscopy to expand our services. Our goal is to get more clinics and be the preference of the veterinarians in this area. We're busy, which is good, but we're always looking to expand. That's our goal.
So there is room for you to grow.
Yeah, definitely. I mean, there's always room that we could add another sonographer down the road. There is definitely room to grow, but right now it's a matter of getting more clinics.
Right.
We've added several clinics this summer. A lot of it is word of mouth, which is really good that we don't have to do as much in-person marketing, but we want to do more in-person marketing for our endoscopic services as well. So it's always just going out there, meeting people, networking. My partner does our online presence. So she's always looking for people to network. It's just constant looking for people to expand our services to.
Do you have any competition? Is anyone else doing what you do?
There are a couple of people. There's actually a corporate service that does mobile. So they have mobile surgeons, cardiologists, and internists, and they're corporate. So they're nationwide. They do have some clinics that are further south from us. And then there's a couple of other internists that have done some mobile stuff around the area. The main one is probably just the corporate that we're competing with. We're small, independent, a little bit more boutique because we're available, we're easily accessible. So we really try and offer a lot of one-on-one service. You're going to talk to either myself or my partner when you call up. You're not going to talk to an answering service or a receptionist. It's the two of us doing everything, advertising that as a pro.
Yeah, I would think that that's such a plus because the pet industry is such an emotional industry and your margin for error is like that.
Yeah,
So, yeah, I would think that it's such a plus for the clinics to be able to talk to you directly and know that they're not dealing with some big box kind of veterinary specialist.
yeah, and so that's, I think, what we really offer. I mean, we don't have flashy marketing materials like a corporate service, but you are going to have me available, and I love to teach also. So when they have students at the clinics or interns, I am absolutely happy to go over stuff and teach them. And that is something that a lot of the veterinarians really like. They like that they can come in and get a really good explanation that is thought out. They like that they can have students come up and talk to me. We're not rushing out and I'm not sitting there not talking because not everybody likes to teach. That is definitely a big plus that I focus on as well when we're advertising, that teaching is part of it.
Do you have them sign some kind of contract, like a year-long contract, that you are specifically working for this clinic for the next however many months?
We don't have a contract where they're locked in. I think that's because in general with veterinary medicine and specialty medicine, they don't have that. They can send to wherever they want to send. So that would be kind of a new model in veterinary medicine to be locked in. And I don't know how that would necessarily go over without having the ability to have the choice. So really, the goal is that they want to come to us. They want to use us. They're stuck in a contract that
Right.
they really want our medicine, or if there is an issue, or if they need something else, that they come to us and we are able to adapt to whatever they need. And so we just have a basic contract that says, hey, you're going to pay us and you're still in charge of the case. So all medical decisions are still underneath that veterinarian. They know that I'm not talking to the client, that we don't have sedation drugs, that we're using all of theirs. So the veterinarian is really still in charge of the case. That's our basic contract.
So looking ahead 6 to 12 months down the road, what would success look like for you and your practice?
That's a good question. I would like to do a lot more endoscopy. So I'd like to grow our endoscopy service. Right now, we're doing endoscopy, but it's not as much as I would like. I would actually really enjoy doing a lot more of that. And then adding just more clinics, adding another 5, 6 clinics down the road is what I would really enjoy doing. I
Mhm.
like my job now. So I like going out, doing the scans, and talking to the veterinarians. I've always really enjoyed that part of my job, is talking to the veterinarians and teaching them about medicine and what I think, and being able to come home and look up things that I haven't seen before and dive into pathology. I really like doing this myself, so I don't want to give that up to anybody else because I actually enjoy it.
I would really like not being stuck in the same place all the time. I would love being able to go in, do the service for them, get in the car and go to a new place and do a service for them and not having to stay in one place all the time. But it may not be great to have to deal with the traffic and move from spot to another.
Yeah, in LA, it could be a little bit. So we try and work our days to where we're seeing the ones that are farther away in the morning when traffic isn't as bad. It doesn't always work. We have some clinics that see emergencies, so we'll have to do things later on in the day. If possible, we try and really schedule so that we're doing the least amount of driving or stuck in traffic. I like seeing the staff from other clinics. So we like going to certain clinics and getting to know the staff and doctors. And it's nice also being able to do the scan and then leave and not have to worry about doing more. I have to write my reports, but we don't have to sit there and do more communication or callbacks. That used to really take hours of my day. I can go, I can write my report, and then that's it for me.
What do you see are the bottlenecks in your business right now?
So I think economy is always something that we look at for specialty medicine, how much clients can afford as
Mhm.
far as what are they willing to do? Are they willing to do the ultrasound and the endoscopy? And so that's something that I think would a little bit more concerned about kind of going forward with people just not having as much money. Specialty care in other clinics can be very, very expensive. And I don't want to price anybody out of doing an ultrasound. So it's important to me to keep prices to where they're accessible so that my partner and I can pay our bills and we can have a good quality of life, but that people are still able to afford these tests that might be more expensive someplace else, but they're still affordable with us. That's always something that we're on the lookout for, making sure our prices are not going to price people out. I think the other thing is getting other veterinarians to realize the value of our service and why it's different for me to do an ultrasound than for somebody who's done a course on ultrasounds. So that's always something that we're struggling with as well. I think that's probably pretty good. We talked about the relationship between the specialist and the general practitioner. I actually gave a talk on that for a whole lecture. There was a conference and I gave a talk on the relationship and some of the issues that general practitioners run into, talking to a specialist, and that I run into as a specialist. And so that relationship is something that I'm always striving to improve upon and make sure that it's a mutually beneficial arrangement as well.
Are you seeing a lot of burnout?
I had burnout definitely because I had just been working so many hours, 12-hour days. I was tired and cranky all the time. I've known technicians that have done the same. Some of my classmates have had that where they don't want to be in practice anymore and they're trying to do something else. They're teaching at a school or something different.
Yeah.
So it is definitely something in our field for a variety of reasons. I don't think I realized I was burned out until I left my job and started this and realized, oh, okay,
Hey, I have
yes,
a life again.
I have a life. I like my job again. I'm excited again. I don't just feel like I'm going through the motions like I was starting to get. So it's something that is 100% in our field. You could see it on some of the staff or the veterinarians' faces when they're just slammed and overworked and they just are kind of at their breaking point.
Well, this has been so insightful. Thank you so much for taking time to talk to me. I really appreciate it. Just stay in touch.
Yeah, this is great. Thank you so much.
Have a great week.